Well, Dr. Emanuele Capobianco is the Director of Programming at the WHO, and he joins me live from Geneva. Emanuele, thank you very much indeed for your time. We've seen some countries in Europe, perhaps not the United States, moving towards, at least in the new year, mandatory vaccinations. Is that something that the WHO would recommend?
Well, within the WHO Foundation that I represent, we believe that vaccinations without imposing mandate is always preferable, particularly convincing people, bringing people along towards accepting vaccines. We know though that certain countries are moving in a further direction. That, of course, is a decision that rests with the countries. But we also know that in great parts of the world, there are, and I'm thinking about low-income countries, there are more than 80% to 90% of the population that is without the first vaccines. And so we are really pushing for increasing the vaccination rates primarily in low-income countries.
So that's the priority then, or perhaps these two things are not mutually exclusive, but would you say the priority has to be getting first vaccinations for people in low-income countries or getting boosters for everybody else?
I think vaccination is really to get the numbers up in low-income countries. As I said, in high-income countries, you have rates of coverage of 60, 70, 80%. And we are talking about less than 8% in low-income countries. And what we are seeing is that where the virus circulates the most, the risk of mutations, the risk of variants increases. Hence, it's a priority to invest in those countries. There are mechanisms that are like COVAX that are bringing in new doses, but there are also the opportunity for citizens to provide funding through a platform that is called Go Give One, $5 per vaccine for people in low-income countries. So if we get all together, we can certainly push vaccines there, which is at the moment the top priority for maintaining safety in the world.
And when we come on to the new variants, of course, Omicron is the one on everybody's lips at the moment. It appears that we know relatively little about Omicron so far, but what can you tell us? It does seem to be highly transmissible, but is it lethal?
Well, we don't know yet. That is the simple answer. And researchers are frantically trying to understand the transmissibility. And there are some indications that may be slightly more transmissible, but we are still having to wait to understand whether the severity will be lower or higher or the same as Delta, the variant that is more prevalent. We also have to wait to understand whether the vaccines may or may not escape, the variant may escape the vaccine. So there's a lot of unknowns, but what we know now is that we need to double down in the protective measures. So we need to first try to get as many people as possible vaccinated. Then we used to use those measures that we have been all accustomed to, wearing masks, ventilating our rooms, keeping safe distance, and avoid crowded spaces. If we all do that, we can really bring down the risk of these variants and Delta, which is the mostly prevalent variant at the moment, to spread further.
Okay, it's all very interesting stuff. Thank you very much indeed for giving us your analysis there. That's Dr. Emanuele Capobianco. Thanks again.